The White House is aiming to make it easier for Americans to get access to COVID-19 treatments amid concerns from doctors about the lack of supply for those at highest risk. Let's bring in Yahoo Finance's Anjalee Khemlani, who's following that story for us today. Anjalee, what is the plan that the White House has laid out?
Well, Kiko, we know that the White House is looking to give more options in terms of locations where people can get the prescriptions for these pills, as well as those test to treat sites, which, as you recall, is the administration's strategy in order to find these cases and then treat them more. Right now, we know that they are already seeing an uptick in the courses prescribed and used from 22,000 per week to now 55,000 per week. The U.S. government did buy 20 million courses, the most that the company Pfizer has had globally. And that came really as we saw monoclonal antibodies stop working against these new variants. We've also seen that the World Health Organization has put their support behind this pill. In addition, they really didn't have that much support for remdesivir, which we know was sort of that first treatment that we had out there. And remdesivir is also now approved for younger kids by the FDA. So a lot going on. The bottom line, though, right now is really to your point, doctors did feel like there was a shortage and they weren't able to prescribe as much. But there's also another thing going on, which is that it's really recommended for patients with mild to moderate COVID-19 with risk of getting severe. So it's not for everyone, and it really is something that doctors and others are looking to judiciously kind of hand out as needed to individuals. So that's where things stand right now. But really important to keep in mind, of course, that this is, of course, the one thing that is really available out there. Some have been calling it a magic pill, though it isn't quite that. It's just something that is available right now, even as we see, a lag in boosters, a lag in vaccinations, all while we see an uptick in cases now around the country. So put together really the administration's plan to get more awareness out there for those who could benefit from access to this, as well as making sure that those who may be in vulnerable areas, for example, or don't necessarily have access to pharmacies, which is, has been sort of the go-to to distribute some of these, are able to access this right now. Back to you.
Anjalee Khemlani staying on top of the developments for us. Thank you.